I'm going to introduce Dr. Karam Kadur, who is one of our medical oncologists, along with me and Dr. Silk. And Dr. Kadur, thank you so much for being here today. We are looking forward to hearing your talk about treatment options, systemic treatment options for Merkel cell carcinoma.
Thank you so much. Hello, everyone. My name is Karam Kadur. I'm one of the medical oncologists here at Dana-Farber Cancer Institute, and I focus on the care of patients with skin cancer. Dr. Silk and Dr. Margalit did an outstanding job explaining the principles of diagnosis of Merkel cell and this surgical and radiation treatment. And I hope to complement this talk giving a brief overview of the systemic treatment options. So I have no disclosures, and I'm including some off-label FDA medications that we sometimes use for Merkel cell. And these are some abbreviations, and I just would like to draw your attention that every time you see a green star on a slide at the right top of the slide, that represents a slide talking about metastatic Merkel cell. So as Dr. Margalit mentioned and Dr. Silk, we have three main approaches to care for patients with any type of cancers, including Merkel cell cancer. We have surgery, which represents taking out the cancer, radiation treatment, and infusional treatment or systemic treatment. Most of the times, infusion means a medication that is administered intravenously. Sometimes it could be in the form of pills and could be taken orally. So each row here represents a way we approach patients with Merkel cell cancer. So you see the first four rows represent approaches to cure Merkel cell cancer when it's locally advanced or not metastatic, when it's confined to just one or a couple of parts of the body that we believe surgery with radiation or radiation by itself could take care of the cancer. And it's not until the cancer is a stage 4, meaning it has spread away from the main site where it originated, that we would need to discuss systemic treatment. So when we think about systemic treatment, there are four main characteristics that we'd like to see in a treatment so we consider it reasonable for a patient with Merkel cell cancer. The first one is the medication needs to be effective against the cancer. The second one, this effectiveness needs to last for a long period of time. This is what we call a durable control of the cancer. The third principle is having a safe medication with a tolerable side effect profile. And the fourth one is that the medication, we don't want it to cause any impairment of quality of life, and as a matter of fact, improve quality of life if possible. So this is a depiction about the changing landscape of what type of treatments we have for patients with Merkel cell cancer. And just to draw your attention, there are different color boxes. What you could notice from this is that you see a lot of green and a lot of yellow. So green represents chemotherapy, and yellow represents immunotherapy. And you can tell here from this graph that until 2016, the only systemic treatment options that we had to offer to our patient was chemotherapy. And it wasn't until 2016 that we learned that immunotherapies are very effective in the management of this type of cancer. Now, the main issue and challenge with chemotherapy is that many people, when they receive this treatment, they have some sort of a response, meaning the cancer shrinks down, sometimes disappears. The main issue with chemotherapy is that this response is not durable, it's short-lived. And the other thing, the side effects that are associated with chemotherapy are cumulative, meaning the more chemotherapy we give, the more we expect to see side effects. And then you see, luckily, since 2016, and because of a great research effort, we were able to develop compounds that we call immunotherapy now that have shown to be very effective in Merkel cell cancer. So this is the principle of how immunotherapy works. And this cartoon just basically talks about the idea that cancer cells are able to express these proteins that can put our immune systems into a dormant phase. The immune system is able in normal circumstances to eliminate cancer cells, but the cancer sometimes it is smart that it's able to evade this immune system by expressing such proteins. And what immunotherapy does is basically it attaches to these receptors and take the brake off the immune system and allows the immune system to be overactive to eliminate the cancer. Now, when we look at immunotherapies in Merkel cell cancer, and this is talking about not only metastatic cancer, stage 4, but also some patients with Merkel cell cancer, they get their surgeries, they get their radiation, but unfortunately, the cancer could come back at some points. And that's when we need to have effective treatment. So that's what we call a recurrent cancer, not necessarily stage 4, but something that we sometimes consider systemic treatment for. And the other thing is sometimes the cancer is localized in one part of the body, but it could be difficult to treat it with surgery or radiation. And that's when we could use systemic treatment in such cases. So you see here 3 different drugs. These are the names: avelumab, pembrolizumab, and retifanlimab. All these are immunotherapies. And all what you need to see from this graph is that the response rates in trials of patients with Merkel cell cancer were high. So about 50% in some trials, in others 60%, patients had some sort of a response when they were given these immunotherapies. So we learned from these trials that the medications, these immunotherapies, were effective against this cancer. The other thing is that we learned also from these trials that immunotherapy could be effective even in patients who already received chemotherapy. So even if we use the immunotherapies afterwards, it could still be effective. However, we know that if it's used after chemotherapy, it might not be as effective as when we use it upfront. And that's when we have a discussion about systemic therapy, we tend to recommend immunotherapy. The other principle of what we look for in a good, effective systemic treatment is a durable cancer control. And what we learned from clinical trials of these immunotherapies that all the responses that were seen were durable, and about 70 to 80% of patients who had a response to these immunotherapies, they lasted at least 12 months, and some of them are still ongoing. Now, the last 2 principles, which are very important components in choosing any systemic treatment for cancer, is a safe medication and that also that does not impair quality of life. So we have a challenge with, like any other medication, immunotherapy has the potential to cause some side effects, and Dr. Cohen already talked a little bit about this. Basically, when our immune system is activated, sometimes it can cause inflammation in normal organs of the body, and this could happen randomly anywhere in the body, and that could lead to side effects. In the clinical trials of immunotherapy in Merkel cell cancer, we learned that the severe intolerable side effects were not very high. About a third of patients experienced that, which is not a small number, but at the same time, most of these side effects are manageable, but it's something that we discuss with our patients prior to starting any immunotherapy. Now, another thing that we try to answer with clinical trials was to try to combine more than one immunotherapy together and give it to patients with Merkel cell cancer, something similar to what we have done in other skin cancers. So this is a clinical trial that asks the question, if we give more immunotherapy combination, would that lead to better outcomes? And what we learned from this trial is that adding more than one immunotherapy at the same time might not be as effective and could lead to more side effects. So that's why currently, when we discuss immunotherapy with our patients, we tend to use single agent immunotherapy. Now, the great thing is now we're learning more and more about immunotherapy, that it's effective not only in the stage 4 metastatic setting, but sometimes in combination with surgery and radiation to increase chances of cure and improve outcomes. So with surgery and radiation in early stage localized Merkel cell cancer, the goal of treatment is cure. However, as Dr. Silk have alluded to, we do monitor our patients for some time after they receive these treatments because we know these cancers, they have a tendency to come back. And when they come back, we'd like to catch them at an early stage. So, and that's when this trial was designed to ask the question, well, how about if we add immunotherapy prior to surgery and radiation in patients who have a big cancer that might be challenging to resect or radiate? And what we learned from this trial, which was a small trial of only 39 patients, but we found out that patients receiving immunotherapy, just 2 infusions prior to surgery, 60% of these patients at the time of surgery, when we looked at their tumors that were resected under the microscope, had completely disappearance of their cancer, which told us that the immune system was activated and was able to take care of the cancer and shrink it and eliminate it in most of these patients. So this is very exciting to learn that we could use something like immunotherapy in some instances to help increase the chances of cure for our patients. Now, we have other types of immunotherapy, and this one is an injectable immunotherapy. So it's a virus that does not have the ability to infect, but was genetically modified. And we know that this virus or medication that uses a virus particle called TVEC, when we inject it on a skin lesion of patients with Merkel cell cancer, it could have a potential effectiveness against this cancer. And the idea is that by injecting this virus, it can cause local inflammation that could activate the immune system. And these are some of the publications that use this injectable immunotherapy. And you could see on the left side, all these lesions before and after injection, how they improved, and both on skin examination and on repeat imaging. Same thing, on the right panel, you can see also other patients who were treated with these injections to help control their cancers. Now, we believe here at Dana-Farber that providing access to patients with Merkel cell cancer to novel clinical trial is crucial to improve on outcomes. And I'm just going to shed light on some of the clinical trials that we either have ongoing or future clinical trials. So this is a clinical trial of an intratumoral injection. So patients with Merkel cell cancer, they need to have a skin lesion that is accessible for injection. And we have a trial that combines both the infusion immunotherapy with this injection to see whether it could improve responses and lead to a better outcomes. Another clinical trial that we will have soon available is the use of ATR inhibition. Basically, ATR is a protein inside the cancer cells that help repair the cell and prevent it from dying. And the idea of this novel drug that by inhibiting the ATR protein, we prevent the ability of the cancer cell to survive. So this is a very promising clinical trial, but we will await to have our patients on it and await outcomes. Another clinical trial that I would like to talk briefly about, is an injection of another type of immunotherapy in patients with different types of skin cancers, including Merkel cell cancer. And actually, this trial is very important in my mind because this trial is focusing on patients with solid and bone marrow transplants. We know that those patients are at higher risk of developing these aggressive cancers, and usually they do not have access to conventional clinical trials. But this trial is designed specifically to try to improve outcomes in this population. And the last trial that I want to talk about briefly is using the immunotherapy adjuvantly. What adjuvant means is using immunotherapy after doing surgery with radiation. And basically, the concept is by providing immunotherapy for a period of time, in this case, in this trial, for 2 years after surgery, we would like to see whether that would lead to improvement in outcomes in our patients and preventing the cancer from recurring and coming back. So we're eager to see the results of these trials. So in summary, immunotherapy is an approved and forms the approved medication for the treatment of Merkel cell cancer and forms the cornerstone of the systemic treatment. Multidisciplinary patient-centered care approach is essential because we see that sometimes the management does not include one type of approach, but sometimes we have to combine different modalities, and that's why it's very important to hear everyone's opinion and have a discussion with the patient prior to starting treatment. And the last thing is access to novel clinical trials is also essential in the care of patients with metastatic cell carcinoma. And with that, I would like to thank everyone.